Hi, I'm Dr. Katie, the Senior Centered Physical Therapist, and welcome back to my channel. Today we have a special treat as Ashley Reagor, a physical therapist who specializes in pelvic health, is going to be here to play a little game of fact or fiction. Ashley has been a physical therapist for 15 years and owns a private practice in Henderson, Nevada. You can check her out at actiontherapeuticspt.com. Also, if you want more information from Ashley, please check out my blog article at theseniorcenteredpt.com. We are so grateful to have Ashley here today. So let's hear what she had to say about our fact or fiction questions. Ashley, thank you so much for being with us here today. We are so excited to have you and so appreciate all of the wisdom that you're going to share with us.
Thank you for having me.
Absolutely. So we're just going to jump right into our game of fact or fiction for pelvic health here.
All right.
So the first question we have is, when I sneeze or cough, I experience a leakage of urine, but that's not incontinence. That's just normal aging, right?
False.
Okay.
That is not normal aging. That's a myth I'd really like to dispel. The reality is that is what we call stress incontinence. And while it unfortunately is very common, it can be treated, it is treatable, and it is not normal. And that's the most important thing to note, is not normal.
Okay, great. So someone who might be experiencing that can come to a physical therapist like yourself that specializes in pelvic health, and they'll have treatment options for them.
Absolutely. Yes.
Awesome. Okay. Question 2 is, I have incontinence. So if I drink less water, that will help. Fact or fiction?
Fiction.
Okay.
So that will maybe decrease it in the short term, but the reality is that can be more irritating to the bladder. It can make a person more prone to urinary tract infections, which, especially in a geriatric population, can lead to greater hospitalizations. So no, drinking normal fluid intake based on your body weight is important. And that is hugely important. So no, dehydrating yourself is not the answer.
Okay. I'm so glad to hear you say that, because as a rehab therapist, I get that a lot. Like, oh, I don't want to have to bother the nurse or the CNA, so I'll just stop drinking. And it's a very common solution, but it's good to know that that's actually going to make the problem worse, so I can educate my patients on that. So drinking water, important for the bladder as well as the whole body. Good. Okay, question 3. I'm having pain with sex, but once again, that's a normal part of aging, right?
Fiction. No, there's a lot of different reasons that could be occurring.
Okay.
One primarily is that our estrogen within our tissues is decreased, especially after menopause. So the tissues can become more fragile. There can also be aspects of prolapse that might be creating tension and interference in a sense. So there's lots of different aspects of that can be assessed. So fiction, it should not be normal.
Okay, good. So anybody out there that's experiencing that does not have to just put up with that or just stop having sex because they're older. They
Correct.
can.
Not at all.
Good. Okay. So the next question is also talking about sex. So number 4 says erectile dysfunction is a normal part of aging and only medication can help this.
So that is not true. There's aspects where any components that affect the pelvic floor musculature can assist with an erection.
Okay. So once again, they can possibly see a physical therapist such as yourself to help work on those things.
Yes.
Excellent. Okay. Last question. We just breezed right through this. It's better to just wear Depends at night rather than get out of bed and use the bathroom.
Fiction. So there's a lot of aspects of that where essentially wearing a Depends at night would mean that you are basically, urinating in your pants.
Mm-hmm.
That's not really the answer, nor is waking multiple times through the night. So the benefit of pelvic floor therapy is bladder retraining. So after the age of 70, it's normal to wake once a night to urinate, but every time that you wake up is a lost hour of sleep. So we really want to decrease that. And so it's important to get on a normal voiding pattern and not be up multiple times at night.
Awesome. So that's great too, because I think it's not just the fear of having to get up is not just of falling or things like that. It is of disrupting sleep. So the idea that pelvic floor therapy isn't just so that you'll have to not go to the bathroom. It's that you'll also get the sleep and have the strength and all that kind of stuff to support your bladder so you don't have to keep disrupting your sleep as well.
Absolutely.
Okay. That's wonderful. Well, that was the end of our fact and fiction game. And I really, really appreciate all the help that you gave us with that, because I know a lot of people struggle with these issues, but there's something that we don't necessarily talk about in our society. And sometimes we're afraid to bring it up with our physical therapists as well. So the work you do, I'm just in such awe of, because it's so important, especially to the geriatric community, but so many people. And so I just thank you so much for the work that you do.
Thank you.
Anything else you'd like to share with our audience before we sign off?
Just know that pelvic floor therapy is completely covered with Medicare and through most insurances. And so if you have any questions, feel free to reach out.
Wonderful. And we'll make sure we have links to Ashley's website as well in the show notes below. Thank you so much, Ashley.
Thank you.
Thank you so much for watching this video. I hope you got so much out of Ashley's information and wisdom. I know I did. She is so incredible, and we're so grateful that she was able to help us with this topic. Remember to check out her website, actiontherapeuticspt.com. Also, for more information, check out my blog article with a different interview with Ashley at theseniorcenteredpt.com. Until next time, I'm Dr. Katie, the Senior Centered Physical Therapist. Have the strength to live life to the fullest. Bye-bye.